So the NHS is recruiting from red list countries for healthcare jobs, but they shouldn't be. But they are. What does this mean for you? Does your country fall in the red list? What if your country doesn't fall in the red list? What even is the red list? Can you still apply? What are your chances? And what on earth is going on with the healthcare system in the UK? Now, just like the healthcare system in the UK, this is looking really chaotic. We need to simplify this. Hi, if you're new to my channel, my name is Ashika, and on this channel we talk about how you can move to the UK amongst a lot of other things and a lot of other countries. If you're new, hit the subscribe button. So the UK's health system is absolutely a mess at this point, and I'm guessing you know that. Now, if you don't know this, you really need to. I mean, here's the thing. If you plan on moving to a country, you honestly need to know everything that's going on, especially when it comes to healthcare, when it comes to immigration, when it comes to jobs in that country, and you need to keep yourself updated. So if you've missed out on all of the action, let me give you a quick gist. Now, according to news outlets, the healthcare system in the UK is honestly crumbling at this point. If you wait for an ambulance, you can be waiting for up to hours versus last year when it took like 14 minutes for an ambulance to get to you. Patients are now sprawled out in the corridors of hospitals, and a lot of ER examinations are going on in closets instead of examination rooms. Now, obviously, Downing Street outrightly rejected this, but the president of the Royal College of Emergency Medicine said that 300 to 500 patients were dying every single day due to lack of urgent medical care. If you've opted for elective surgery, the wait time is anywhere between 18 months and 2 years. And if you need to see a GP, the average waiting time for an appointment is anywhere in weeks. And I know this for a fact because I just tried getting an appointment with my GP a couple of days ago, and they said this straight out that I would be waiting for at least 2 weeks for an appointment. Now, let's talk about why this is happening for a moment, because it's really important for you to understand this. One of the many reasons which has led to the collapse or the near collapse of the NHS in the UK is the shortage of staff. Just among health aides and nursing home staff, there is said to be a shortage up to the tune of 165,000 people. When it comes to nurses, there's a shortage of about 50,000 nurses, and this isn't even counting doctors. Now, one of the other reasons for this is Brexit, because a lot of healthcare professionals had to leave the country as a consequence of this. And some of the top areas that are struggling because of this is the UK doesn't have too many anesthesiologists or cardiothoracic surgeons. Now, according to BMJ, over the next 12 months, about 1/3 of all of the junior level doctors in the UK are planning on leaving the UK and going to work elsewhere, primarily for two reasons. The first one is pay, and the second one is, well, the working conditions in the UK. Now, to add to all of this comes in the confusion of the red list. What's the red list? Well, here's the thing. A couple of days ago, The Guardian put out an article saying that the NHS and its agencies were recruiting from red list countries, even though they were not supposed to. Now, for those of you who are unaware, the red list is based upon the WHO, the World Health Organization, Workforce Support and Safeguard List. And it basically comprises of countries where the NHS should not be hiring from because it would compromise the healthcare systems of these individual countries directly. These are typically middle-income countries that are identified as experiencing structural workforce shortages. The safeguards are in place to protect hospitals and health systems in low-income countries, with 89% of global nursing shortages in those countries. Now, in case you're wondering which countries fall under this red list, and even if your country falls under this red list, there's a quick way to find out. Take a look here. All of these countries mentioned here fall under the red list. There's also an amber and a green list, which you can check below. Now, in an ideal scenario like you just saw, the NHS and its allied trusts and agencies are not supposed to be hiring from red list countries, but now they are. But before I move ahead, if you haven't hit that subscribe button, now is an absolutely great time to do it. Hit the subscribe button now and click on the bell icon for notifications. Now, here's the thing. If you are looking to move to the UK as a healthcare professional, there is absolutely no better time than now to sign up for my course on how you can move to the UK. It has all the details on how you can get a job in the UK, how to make that CV, what is the process you need to follow, where to look for jobs, and all the 9 yards. If you need more information, visit the description below. So is this really good or bad for you? The restriction that the NHS had placed was on trusts and agencies. But does that mean that if you belong to a red list country, you cannot apply for a healthcare job in the UK? Absolutely not. If you belong to a red list country, you can still apply as long as you apply independently. If you apply independently directly to the NHS without the help of any agencies or any trusts, You have absolutely no problem. Even if you belong to a red list country or an amber or a green, you can still go through. There is absolutely no issue. If you belong to a red list country, well, typically agencies and trusts should not be hiring you, but now they are, which drastically changes things. Now, the most obvious takeaway from all of this is that if you are planning on working in the UK and moving to the UK and you are a healthcare professional, well, your timing couldn't have been better, to be honest. The UK is desperately looking to hire staff to support the crumbling NHS and the healthcare system in the UK. So hiring is at everyone's minds, at the forefront of everyone's mind. And this includes hiring for doctors, nurses, healthcare professionals, care professionals, all of it. And you know this is a fact because if you've seen any of my previous videos, you would have seen that I've shared openings for nurses, for dentists, for physiotherapists, for all sorts of healthcare professionals for that matter. The UK is actively hiring. Now, if you are a healthcare professional and you want to move to the UK, there are two ways you can go about it. The first way is obviously you can check all the job portals. So you can check LinkedIn and Indeed and the NHS government web portal, which has, well, all the jobs that are listed under the NHS. And I will leave links to all of these in the description below. The other way to do this is by approaching agencies that are allied with the NHS, trusts and agencies that recruit specifically for the NHS. If you've belonged to a red list country in the past, you probably wouldn't have gotten hired through them. You might have faced rejection in the past, but don't be put off. This is the time to apply, especially if you belong to a red list country. There's a very high possibility that you can convert your jobs right now if you have the right qualifications. So at this point, if you are a healthcare professional looking to move, do not let anything hold you back. Now, here's a word of caution before you start out, because I think it's really important for me to put all the facts before you so that you can make an informed decision before you rush into anything. The first thing, when it comes to agencies, well, some agencies are reliable, some are not. And it's really scary because I get a lot of people that write into me saying they got scammed by agencies because they tried paying for a visa. Well, the agents took their money and disappeared. So be extremely careful when you are looking for agencies if you decide to take that route and apply for a healthcare job. It's not sufficient for you, and I actually wouldn't even recommend it for you to look for agencies with Google ratings or reviews online. Well, how do you know if you can even trust the reviews, right? The smarter way to do it would be to ask your friends, your family, your colleagues, anybody who has already moved to the UK or who is in the process of moving, and ask them for referrals of, well, agencies that can be actually trusted. Go with an agency that someone has used and that has worked out really well for them, rather than relying on the information you see on the internet. The second thing you need to keep in mind, well, the doctors and the nurses and the ambulance workers have been striking in the UK for a little while now, mainly because of pay scale, because they aren't getting paid enough. So you might want to do your own research, a little reading up into seeing how much you can expect to get paid, why the nurses are striking in the UK, and what the challenges are that you can anticipate when it comes to pays. And the third thing is, you know the healthcare system is struggling in the UK. So that means if you move to the UK as a healthcare professional, be prepared to work difficult hours, long, difficult, challenging situations at your workplace. Because like I just said, well, it's not the easiest situation here right now. So you will have to be mentally prepared, well, to not have the easiest work environment initially. Now, here's the thing. Before you rush off to actually start looking for jobs, the first thing you need to do is understand what the procedure is and what the process is for you to get a healthcare job in the UK. Well, it's quite a long process. If you need any help understanding how that works, all you need to do is watch this.